Welcome to the third week of our online course on Community and Public Health lecture. Our discussion for today is about safety in the workplace. The objectives are to explain the difference between occupational injuries and occupational diseases and give several examples of each. Second, to discuss the types of injuries that frequently occur in the workplace and describe their occurrence with regard to person, place, and time, and to briefly describe broad strategies for preventing injuries in the workplace. I'm sure you've already heard about reported cases of workplace accidents or illnesses that develop because of the nature of the work of the person. Or maybe you have also read about published journal articles about the different risks and dangers existing in the different jobs or profession. According to the Philippine Statistics Authority, the wrists and hands are the most injured part of the worker's body. This is followed by the lower extremities, then the arm and shoulders, and neck as the least injured. In 2015, the topmost agents of occupational injuries are machines and equipments, work materials, and general hand tools. For those who are working in health and social work, except for public health, dislocation, sprains, and strains are the highest reported cases of occupational injury. Stepping on or being struck by an object is the most reported cause of injury in the said occupation. And the use of machines and certain equipments naman ang most common agent of injury and significantly followed by exposure to certain chemical substances. Now, if the situation is like this in the Philippines, imagine what it is like in other countries where safety in the workplace is not a big deal. Because of the increased number of reported cases of work-related injury, sickness, and death in the United States, the OSHA was established in 1970, December 29, when the OSHA was signed into law by President Richard Nixon. OSHA stands for Occupational Safety and Health Act. Following the enactment of this law is the establishment of the OSHA. OSHA, or also known as Occupational Safety and Health Administration. The primary work of OSHA is to enforce standards and provide trainings, outreach, and education, and also assistance to business enterprises and industries. Because of the OSHA also, in 1970, ang National Institute for Occupational Safety and Health was established. The NIOSH is actually a research body in behalf of OSHA. The NIOSH is under the umbrella of Center for Disease Control and Prevention, or the CDC. Now, OSHA promulgated standards that serve as guidance and protection for workers as they perform their job. The very first standard established was for those with exposure to asbestos, and this was passed on 1972. For individuals who were exposed to asbestos fiber, they developed the so-called asbestosis. This is a chronic lung disease manifested by lung scarring and difficulty in breathing. So, to prevent that from happening or to prevent the workers from developing asbestosis, so the standard on asbestos was released by OSHA in 1972. Now, throughout the year, several standards have been established by OSHA, and likewise, trainings were also provided to ensure the proper implementation of these standards. In 1984, the ethylene oxide standard was enforced to protect particularly those working in the healthcare sector. And speaking of the healthcare sector, in 1991, the bloodborne pathogen standard was implemented to protect individuals who are in direct contact with samples potentially infectious for bloodborne pathogens such as or particularly HIV or human immunodeficiency virus and hepatitis B virus. And because of the bloodborne pathogen standard, there was a dramatic reduction in the number of hepatitis B infections among the healthcare workers. And in relation to this, in 2001, the Needle Stick Safety and Prevention Act was signed into law. And in 2001, the OSHA included in the bloodborne pathogen standard the possible exposure to bloodborne pathogens with the use of needles and other sharps. And because of the strengthened bloodborne pathogen standard, it resulted to a decrease in the number of needle sticks and other sharp injuries. And up to the present, OSHA still continues to release work guidelines that advocates work safety. In the Philippines, we also have our own version of occupational health and safety that was established in 1978. The Philippine version of occupational safety and health standards have the same purpose of protecting the safety and well-being of the workers in their respective workplaces. In 1987 Philippine Constitution, the occupational health and safety was included as a constitutional objective. And the government body assigned to implement these standards is, of course, the DOLE or the Department of Labor and Employment. In the labor code rather, there we can see the many standards on occupational safety and health. And most recently in 2017 is the enactment of RA 11058 or the Occupational Safety and Health Standards Act. This is an act strengthening the compliance and occupational safety and health standards and providing penalties for violations. Now, you may have asked, why are there institutions and organizations that advocate occupational safety and health? Class, please bear in mind that occupational safety and community health problems are linked in some ways. The workforce comprises a big portion in the population, and as the working group, they are potentially exposed to different hazards and dangers in their respective workplaces. And likewise, occupational health and safety is a basic human right. Every worker should carry out their job in a safe and healthy environment. Hindi yung environment na makakapagpa-endanger sa kanilang mga buhay. But before we discuss occupational health in details, let us first define some terms. Occupational medicine. It is a medical specialty that concerns itself with all aspects of health in relation to occupation. Occupational illness is any illness or disease caused by workplace environmental factors. These illnesses may be caused by inhalation, absorption, ingestion, or direct contact. Example, medtech, working with a sputum sample potentially infectious for Mycobacterium tuberculosis. Now, si medtech, unknowingly na-expose siya and then later on naka-develop siya ng TB. And then si medtech, wala talagang matrace na possible exposure with TB other than sa kanyang exposure with the sputum sample that he handles. So that is an example of an occupational illness. Nakuha lang ni medtech yung TB or tuberculosis because of the nature of his work, no, when he processes sputum sample. Occupational injury naman is any circumstances that resulted from a work-related event. This may be a cut, a fracture, a sprain, an amputation. So these are examples of injuries that resulted because of work activities. Occupational hazards naman are any hazards or sources or situations with a potential for harming in terms of injury or ill health. It can also cause damage to property, damage to workplace environment, or a combination. So sa ating example kanina na si MedTech, processing sputum sample potentially infectious for Mycobacterium tuberculosis. So the occupational hazard there is the source, which is the sputum sample, the biologic agent, which is the Mycobacterium tuberculosis, and then the situation is when he processes sputum sample without using any biosafety cabinet. So, yun ang example of occupational hazards. Hazardous materials naman are any substances in solid, liquid, or gaseous forms known to constitute poison, fire, explosion, or health hazards. So we can define occupational health as the promotion and maintenance of the highest degree of physical, mental, and social well-being of workers in all occupations, a total health of all at work. Remember the definition of WHO of health? Diba? According to the WHO, health is the state of complete physical, mental, and social well-being and not just the absence of disease. Now, this same definition applies for occupational health. It's just that the occupational health is particularly work-related and it advocates the health of the working population. Now, the next question is why? Why are we discussing occupational health? What's with work and work activities in relation to health? Now, as I have mentioned earlier, class, the occupational safety is closely linked to community health. Likewise, work influences physical and the physical safety and health. There are hazards in the workplace that would risk the health and even lives of the workers. Example, yung mga machines, mga electrical wirings, engineering of the facility, the architecture of the facility, and other workplace factors, no? Or pwede din mga hazardous conditions that would result to injury and even death of the worker. Typical example nito, class, is COVID. COVID is an example of a hazard na pwedeng makapag-endanger sa physical health ng ating mga frontliners. Another reason, class, is that work affects mental health and well-being. Well, mental health is a very broad topic. And mental health problems are most of the time multifactorial. Health illnesses kasi may be due to family history or health behavior or genetics, gender or personal history, childhood natin. So, and other factors, pwede makapag-contribute yun to developing mental illness. Studies have found out, class, that there are workplace factors that may increase the likelihood of occurrence of a mental disorder. Or if there is an existing mental disorder, pwedeng ma-worsen ng workplace environment, workplace factors. No, example, those soldiers who went to war and came home, a lot of these soldiers develop post-traumatic stress disorder. Or kahit yung ngayon na lang na situation sa ating mga frontliners. Since the start of COVID, there has been so much mental stress that our frontliners are going through. If you have a family member who's a frontliner, you can ask, no, what kind of mental stress they are facing in every shift. Another, class, is the interrelationships of workplace factors and the health of the worker generally affects the business enterprise. Workplace factors can affect the productivity of the employees, class. If not taken into consideration, the employee's performance may decline, resulting to absenteeism, then poor productivity, poor delivery of services, and consequently, poor success of the enterprise. If your family owns a business or kahit yung sa mga movies na lang na napapanood natin, 'di ba successful business owners would say na dapat talagang alagaan ang mga empleyado kasi they keep the business alive. And last reason, class, is that um, despite being stressful at times, no, having a work is still better than unemployment. We all had a glimpse of worklessness when we were put on a strict lockdown. People experience so much hunger, sickness, financial problems, mental health problems, and others. And there is a plethora of evidence, class, supporting the fact that work is actually therapeutic. But it can only be therapeutic if you love your work. Siyempre, if you don't love your work, is may isipan mo talaga na burden lang yung work. Kaya it is important, class, na after you have gained your RMT title, isipin nyo talaga on what track you want to take. Kung sa pagiging medtech ba in the laboratory, or dun ka sa research, or dun ka sa sales, or others. Basta isipin ninyo na yung work na pipiliin ninyo is the kind of work na that you really love. Kasi when you love something, it will push you to continue to work despite the difficulties, despite the challenges that come along the way. Okay, with all of this now, do you see now the reason why occupational health and safety is deemed significant in the health of an individual? Okay. With that, we can say that occupational health is a type of preventive medicine. The goal of occupational safety and health is to promote a healthy workplace and to prevent a hazardous one. As a preventive medicine, occupational health promotes and maintains highest degree of physical, mental, and social well-being of workers in all occupation. Second, it prevents among workers all departures from health caused by their working conditions. It protects the workers in their employment from risks resulting from factors adverse to health, and it places and maintains the workers in an occupational environment adapted to his physiological and psychological capacity. Class, it is important to maintain a healthy workforce. Why? Because it can lower the costs and workers' compensation claims when they got sick. Kasi 'di ba, pag safe and healthy ang workplace, healthy din ang mga employees. Walang nagkakasakit, walang naaaksidente. Pag nagkakasakit pa naman or naaaksidente and upon investigation, ma-find out na work-related ang illness, so babayaran ng kumpanya yung empleyado. And if that is the case, added burden yon to the company. But above all, class, when we uphold occupational health, it means that the lives of the workers are valued by the employers. After all, we must value life more than the profit of the company. And also, occupational health and safety helps to prevent working in a hazardous workplace. Now, how do we define hazardous workplaces? According to the DOLE Occupational Safety and Health Standards, the following are considered hazardous workplaces. Now, dito tayo sa first. If in the workplace, may mga elements or agents such as chemicals, radiations, or fire, or any substances that would endanger the health and life of the worker, then we consider the workplace hazardous. Now, second, if yung work-related activities is considered dangerous, na pwede ikamatay ng pasyente. Example, sa construction. Di ba we've heard stories about construction workers na namamatay kasi nahuhulog or merong gumuho sa site tapos natabunan yung construction worker. No? Other examples are of dangerous work activities are deep sea fishing, mechanized farming, mining, firefighting. For letter C and letter D, of course, if the work involves manufacture of explosives, syempre mataas talaga ang risk of accidental explosion, di ba? And lastly, ito, applicable ito sa atin, mga healthcare workers. Tayo, mga medtechs. We are at risk of developing acquired infections because of the samples that we process in the laboratory. Not only us, actually, generally, kapag ka healthcare worker ka, exposed ka talaga to infections from our patients. Best example nito is COVID-19. Di ba, madami ng mga frontliners around the globe who acquire the infection from their patients. So, to avoid hampering the health of the workers in the different sectors, the occupational safety and health standards are there to set guidelines and policies. Now, in response to the call for occupational health and safety, in 1995, the WHO developed guidance for occupational health, and they called it the Global Strategy for Occupational Health for All. The global strategy focuses on occupational safety and health of all workers, regardless of age, sex, and nature of work or industry. It also calls the government's responsibility to enforce occupational safety and health practices, as well as it calls the government's accountability to create and enact policies concerning occupational health. Likewise, it emphasizes the responsibility of the employers to provide a healthy workplace environment and services for the employees. And lastly, to prevent accidents and occupational diseases from happening. Now, the recent move of WHO when it comes to occupational health is the implementation of Global Plan of Action on Workers' Health for the years 2008 and to 2017 with the following objectives. First is devising and implementing policy instruments on workers' health. Policy instruments class are policy designs or techniques na ginagamit ng mga government authorities when they are trying to resolve issues. Another objective is to protect and promote health at the workplace. Third is to improve the performance of and access to occupational health services, to provide and communicate evidence for action and practice, and to incorporate workers' health into other policies. Um, there are elements that take part or affect occupational health. These elements are the workers, the tools that the workers use, the tasks or the job of the worker, and the working environment of the employee. Now, the combination of the tool, the task, and the working environment had become the most important aspects in the employee's work. Why? Because these elements are what the employees are exposed to in almost a daily basis. With the health workers, with the workers' health kasi class, um, the employers can regulate this aspect kasi. Kaya merong mga medical exams prior to hiring employees because the employers would want to ensure na they are hiring healthy employees. Basic physical exam na nire-require are CBC, urinalysis, fecalysis, chest x-ray. Tapos pag healthcare worker ka, dapat may Hepa B titer. Actually, it's not only physical exam kasi there are also institutions that require psychological exams. So this aspect here can be regulated by the employers. Whereas these three, ito yung elements na exposed talaga from time to time ang mga employees. Now, in the workplace also, there are elements that would directly affect the health of the employees. These are the environment itself, the equipment handled by the worker, and the process or the interaction of the different elements or tasks. Now, these elements class, environment, equipment, and process must be designed properly so that the workplace will be a healthy place and hazard-free. Now, as mentioned earlier, the occupation of the employees directly influence their physical health, mental health, economic, and social well-being. It is not only the health of the employees that are being affected. Kasi affected din ang health ng kanilang mga families, health ng community, and the society in general. This is another reason why occupational health is closely linked to public health. Now, we must always consider class that the workplace is an important setting for health protection, disease prevention, and health promotion. And as I have mentioned, employers have the responsibility to provide a hazard-free and safe workplace. Likewise, they also have the responsibility to promote individual health and foster a healthy work environment. So, as a response, employers can conduct workplace health programs. Workplace health programs refer to coordinated and comprehensive set of strategies which include programs, policies, benefits, environmental supports, and links to the supporting community designed to meet the health and safety needs of all employees. The WHO designed a model for a healthy workplace. And in order to create a workplace that promotes and maintains complete health, no, in terms of physical, mental, and social well-being, no, the the workplace health program that will be designed must touch all of these factors, no? Kasi these factors will affect or will have a direct effect on the health of the worker as well as the health of the worker's family, the health of the community surrounding the business enterprise, and the society in general. These factors are the physical work environment, the personal health resources, the involvement in community activities, and the psychosocial work environment. So again, when designing a workplace health program, all of these factors must be included, no, para holistic yung approach ng workplace health program. This is the model proposed by the WHO. Ang CDC naman class is meron din silang pinopose na workplace health model for health promotion program planning. No, it focuses more on the process. No, first is you do assessment. After assessment of the individual, organizational, and community aspect, you do the designing, the planning, and management. No, and then when there is a plan already, implement, execute that plan, and then after which evaluate the results of the implementation. um Now, if you're still wondering why it is important to promote health in the workplace, well, basically, it can benefit both the business and the employees. So it's actually a win-win situation for the business and the employees. Now, in yesterday's topic, we have discussed about health promotion programs and the steps in crafting a health promotion program. Now, the same concept of health promotion program applies when it comes to occupational health promotion programs. The difference is that there are specific people or roles that take part in the designing of the occupational health programs. These key players are the industrial physician, the industrial hygienist, and the safety engineer. The industrial physicians are medical doctors whose experience is more on the occupational diseases and work-related injuries or illnesses. So kung meron tayong tawag niyan, internal medicine, kung meron tayong pediatrics, meron din tayong industrial physician na pwedeng lapitan ng mga workers if merong work-related illness or disease that resulted. Industrial hygienist naman class, yung expertise of industrial hygienist is about identifying, evaluating, and controlling real or potential workplace environment hazards. Bali yung work niya is he anticipates health and safety concerns. And then he also designs solutions in order to prevent these concerns from happening. So to do this, an industrial hygienist performs risk assessment and analysis to evaluate jobs, operations, machinery, work activities inside the workplace or at the work site. So para ba silang guardians, kumbaga, in the workplace? They foresee kung ano ang mga masasamang pwedeng mangyari, kaya they design protocol and policies in the institution para hindi matuloy ang mga ito. And the safety engineer class is responsible in making the workplace generally safe. So he monitors general work environment, he inspects building and machineries for hazard safety, and he also recommends safety measures for new products or processes. So these three are the key players in designing occupational health programs. These individuals do most of the work in terms of gathering data and analyzing data and coming up with a solution or with solutions and strategies that would help create a workplace that is hazard free. Now, brainstorming yan sila, no? In order for their work to be accurate, of course, there has to be enough data on the different hazards that may be existing in the workplace. And pag-uusapan natin yan, ang mga different occupational hazards in the next video.